To you now.
Good morning, viewers. Good morning, ladies. Good morning, everyone. Good morning, viewers. Um, Happy World Cancer Day. That's what I would call it. It's another opportunity to be alive to celebrate this wonderful day. So, what are we talking about today? The reality of cancer care in Nigeria. And who have I got in the house? I've got Prof. Omonisi, who is the president of the Nigerian Cancer Society, and Titilayo Wamidu, who is a breast cancer survivor. So, where are we? Let's talk. Welcome back to another edition of Kakaki Cancer Awareness with Denise Ejo, the CEO of Comwood Cancer Foundation, in partnership with AIT. Together we fight, together we win. Thank you all for championing our cause as we start 2025 on a very positive note, giving us another chance. So let's see what the year holds and let's see what Prof has to say. Good morning, Prof.
Good morning.
Good morning. And Titilayo, good morning.
Good morning, ma.
How are you?
I'm fine, ma.
So together we fight, together we win. Let's start this thing. I'm going to start this by just giving a briefing on World Cancer Day, because we're going to be having two parts to this. So let's talk about this. What's World Cancer Day? World Cancer Day is observed annually on February 4th and serves as a global platform to raise awareness about cancer and encourage its prevention, detection, and treatment. In Nigeria, this day is marked by various activities aimed at educating the public and advocating for better cancer care. For instance, on February 2nd, Prof. Abidemi, who is sitting here with us, the president of the Nigerian Cancer Society, led the team to the Evangelical Church Winning All Equa in Wuse 2 to start off this awareness by creating cancer awareness and emphasizing the importance of seeking medical advice promptly. Today, we have a host of events going on across the country, ranging from the press briefing of the minister all the way to the um, NAOA, to the Youth Coalition, to all those across the different states. Let's all look at what the conversations are about. What is it about? United by Unique. I love that. I love that. I love that. So I'm going to introduce our guest speakers first, and let's Survivor give us a brief story of her own experience. So, Prof is a meticulous physician and renowned scholar for over 20 years. His research interest is oncology, and he has numerous prestigious scholarships, fellowships, and grants from different universities across the world. And Titilayo is a breast cancer survivor who is currently still in active treatment um, due to some normal behaviors of us as indigenes of Nigeria. So, both of you, I want to say thank you very much for joining me today. Thank you, viewers, for joining us. Let's sit back, let's start the conversation. And I'm going to really focus on the first part of this conversation with Prof. Omonisi. But let's first hear the story of a cancer patient. So, go on. TY. I'm going to make sure I call
Okay.
you TY. That's a guy name. Titilayo, sorry. Titilayo, for the purpose of this. Please share your story as we start the conversation.
Okay. Good morning. Good morning, Nigerians. Good morning, everyone. My name is Titilayo Lovet Wamidu. I'm from Kogi State, Kaba. I my journey started 2021. I noticed a small lump in my breast. That was let's say towards April, May 2021. I noticed a small lump in my breast. I was like, what is this? What is this? I just left it hoping it will go. Because I don't know anything about cancer then. I've not had anything about cancer. So I felt okay, it will go. I stayed. Getting to November 2021, the lump was still there. I went to National Hospital Abuja here. They did breast mammo and the result came out, it was cancerous. I was like, what is cancer, God? They told me about cancer is this, the disease is not good. I have to take off the breast. So I suggested for them to remove just the lump. They said no, they have to remove the breast to stop it to not reoccur again. I was scared. I ran away. I ran away from the hospital. I did not go to the hospital again till 2022. I went back to Asokoro Hospital again in Abuja here to do another breast mammo. The results that came out, it was cancerous. I came home, I told my sister I was devastated, crying. I was confused. My life was shattered. Since then, I did not go to the hospital again. I stopped going to the hospital. Then, fast forward to 2023, I traveled to my hometown, Lokoja. I was doing herbal. The thing got worse that my nipple went inside. Blood started gushing out from my breast. Blood was coming out from my breast. Shirt, if I wear shirt like this, the shirt will be soaked with blood. I was like, God, what is all this? Is this how I would die? Is this how I would die? I started taking Haba. Haba made it worse. My breast busted. The wound was so big. It was smelly, like it was smelling water coming out from my breast. I it got to an extent. I told my dad, I don't want to take anything again. They should just leave me. Let me just die. Let me go. Because the trauma, the pain, the pain is too much. It's too much for me. I told them they should just leave me. Let me just die and go. Fast forward to 2023 again, December. My sister, my uncles, friends advising me to go to the hospital and all that. But before I even say I'll go to the hospital, I had so many things about chemotherapy, that chemo is not good, chemo will kill me, the side effects, the that, the this. I was like, what is all this one again? How about this chemo, this? What is this one? So I decided, okay, I will do the chemo. Anyhow it's going to be, I will do this chemo. God is on my side. I prayed. I came back to National Hospital Abuja here. I started my chemotherapy. Before I started the chemotherapy, there was no fund for me to start. Friends, family members, my uncles, my sister, her husband, my brother, friends, people I don't even know, they supported me. They came through for me. They supported me. I started my chemotherapy. I did 4 sections of chemotherapy. And I thank God the chemo worked for me. I thank God the chemo worked for me like magic. And now I'm on hormonal chemo. I'm on eyebrows on hormonal chemo. And that one again, the side effect is another one. We cancer patients, we are champions, we are warriors. It's not easy to be a cancer patient. If it's easy, go be cancer patient. It's not easy. It's
Thank,
not it's not easy. Thank you, ma.
thank
Thank
you,
you.
Titilayo. You actually brought out the joke that I think we can actually laugh about in the midst of the storm. Um, um, can I ask you a question? You're still in treatment quickly. How much does it
Yes.
cost you for? I want to. That's intentional. How much does it cost you? Sorry, not for your treatment every time. Every time. Now.
Now every month my treatment cost me 1.3 every month.
Okay. So
1.3.
okay, so in that light, that is where this conversation will start from. Thank you for sharing your story, Prof. I am over to you now, and I know it might not be fair, but it's World Cancer Day, and you are the right person for us to talk about what the issues are. And the reason I brought it from this angle, and I wanted this story, is that as of today, the budget for cancer patients in Nigeria, as of today, was put as 150 million naira, which will basically treat less than 20 patients. with cancer. So really, where are we, and what are we going to be doing now? Because basically, Nigerians with cancer are not in a good place. I know you've just taken on office
Yeah,
as a
thank you very much.
boss, but yes, I have to. You know that the seat will be a bit hot.
Yeah, thank you very much for inviting me to share my thoughts. As you have said, today is World Cancer Day, and there's a day all over the world that we remind ourselves how far we've gone, in addressing this global burden. It's also a day for us to take stock and also hold our government responsible. And most importantly, it's a day that's especially devoted for us to interact with the cancer survivor, to find out how far we've gone, the management and treatment, and to mobilize, stakeholders, to support, cancer survivor and also all efforts to combat this disease. Well, as a country, we must commend the federal government. Let me start by that, for their, support over the years. The truth is that the federal government have done excellently well in combating, cancer in the country at the national level. But the major issue we have in our country is with the subnational, with the state government. Some states, in fact, most of the states, there's no desk, office, no desk officer. There's no desk in the Ministry of Health, cancer. In other words, most of the states in the country, you can't find anything that's called state cancer control program there. Most governors, have abandoned these efforts to combat this disease, to federal government. Federal government in 2011, to address your question specifically, created what we call the National, Cancer Fund. And that was the initiative of Federal Ministry of Health. And that fund is to, create a special package to assist, cancer survivors. But the truth is that we must recognize that, all over the world, there's no government that has enough resources to manage cancer patients. It's quite capital intensive. You see the poor, the rich, we become poor, and the poor, of course, become poorer because of treatment. However, what's being done in most countries are their social insurance, their support, mechanism to cushion the effects. And that's what the federal government did in 2011 by creation of that fund. And at the inception, 700 million was credited to the account, but subsequently reduced to 350 million. And in this budget now, what we have there is just 150 million. And we have addressed that at the press conference in early January, to address that issue. That money is grossly inadequate, So as it stands now, I'm happy that Tensilayo, shared, a story, for you to conveniently stabilize cancer patients, you need, an average between 15 million to 21 million. Talking about diagnosis, hospital bill, and treatment, that is the average cost, that range, 15 to 21 million. So how many Nigerians can afford that? So that's what we are talking about. So the amount budgeted for, cancer fund is grossly inadequate. I've interfaced with the Federal Ministry of Health, had a meeting, with the permanent secretary, and we also addressed the press, and the feedback, we are getting is that government will do something about that. It's an opportunity for us to appeal to the National Assembly, to address that, that issue, that's gross underfunding of the cancer fund. That was, the implication of that, if that amount is not top up, is that maybe that fund will be sufficient for, as we have said, just 21 patients. And we have more Nigerians coming down with cancer. The burden of cancer, the war is far, 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 being won. More Nigerians are coming down with cancer. More Nigerians are dying of cancer. So I'm using this opportunity to appeal to the National Assembly, to help us address on the budgeting. And I've said that the minimum that we expect is 1 billion naira, 1 billion naira. Put that 1 billion, but you probably will not address the budget, but, we also have to be sincere with ourselves, should be conversant with what's happening, all over the world, particularly Nigeria with our economy. But I think government can, top it up to 1 billion. That will go in a long way, to help, our cancer patients and survivors.
Thank you, Prof. Thank you for starting the conversation from that perspective, because honestly, in fact, I just recalculated what the figure was, and I realized it could only treat seven patients. That is. So I think two of us on this platform today, are cancer patients, Titila and I, and we appeal to the government that this is a national cry from all of us to please relook at that budget and help us save our lives, because 1 million, I don't see how an average Nigerian can afford that per month. So let's go to the next question. What are the most prevalent types of cancers that are affecting Nigerians today? Because at least once we know that, we can start to work on that. We've got the ones that are only free in the National Health Fund, or Cancer Health Fund. What other ones do we have?
Thank you.
And sorry, let me just ask you.
Thank you very much.
Sorry, let me ask the second one. And how is the NCS, Nigerian Cancer Society, being involved in promoting this awareness? So I'm putting two together.
Thank you very much. Anytime we talk about cancer in the country, even at the federal level, and also people that start responsibility, to make policy, people think, we have prostate, cervical, and breast cancer, so they're really cancer. But that is not the cancer that we have. Every cell in the body has the ability to become cancerous, and then the limit to cancer, number of cancer that we have is unlimited. However, what's been done about the world is for you to stratify these cancers, and that's why you establish cancer registries. Cancer registry has, established to able to collect data of cancers, and they can report, periodically that these are the top 5 or 10 cancers in that vicinity. So in Nigeria, as we speak, based on the last global common statistic, so that is the only one we can officially reference, that was published by WHO, just last year. And the most common cancer, still remain prostate cancer, and that has been, number one for more than, a decade now, and that is followed, by colorectal cancer, and the third of the list, we have liver cancer. Then the fourth, we have non-Hodgkin's lymphoma, and the fifth, we have Kaposi sarcoma. For the females, we have the first, the breast is still the most common cancer. That has been, number one for more than 2 decades now. We followed by cervix, and third, we have the colorectal cancer. And we have the, ovarian coming into it. One thing that is very striking, based on the last publication by IAC and WHO, is that, we begin to see, a changing pattern, in the kind of cancer we have in this country. I mentioned that colorectal cancer is now number 2 in the males, number 3 in the females. And colorectal cancer, over a decade ago, is not a major cancer in our country. When I talk about colorectal cancer, we think of the West, but now we have it number 2 in males and number 3 in females. Our government is not doing about it. That cancer is not covered by, you cover in the, cancer health fund. So that is where we have the issue. You can see non-Hodgkin lymphoma. For example, hematological malignancy is also very prominent in both male and females. That means more Nigerians are coming down with non-Hodgkin hematological malignancy, and that is also not covered in the cancer health fund. So we call that neglected cancer in the Nigerian Cancer Society. And what I've done since I came into office on the 1st of November, is to create awareness on those categories of cancer that are classified as neglected cancer. Neglected because government agencies are not talking anything about it. There is no national strategic plan, to address that body. And more Nigerians are coming down with that cancer, and so down with that cancer. I'm very, very concerning that is that, the younger ones are also affected. We have the young one coming down, colorectal cancer. I'm also a pathologist. I make diagnosis, colorectal cancer in people less than 30. Not 1 or 2 questions.
Okay, Prof, can we take a break now so we can?
Very well.
Can we take a break now, and then we'll come back after this break, and we'll be coming back to continue this conversation. Thank you, both of you. Just take a break. We're taking a break now. We'll come back to join you.
And our guests, they conclude that conversation on the World Cancer Day.
Thank you, viewers, for bearing with us as we continue this conversation. We're going back to Prof, who's going to continue, and we're going to continue with that question. And this time, we're focusing on how the Nigeria Cancer Society has been involved in promoting cancer awareness and prevention. That's where we stopped, and I want us to continue because that's very key for us. Thank you all for staying with us.
Yeah, thank you very much. We're actively involved. Our society was established on the 12th October, 1968. And since then, we've actively been involved. We are a major partner with federal government, cancer development of cancer policy, and also creating robust awareness. But since I came into office, what we're trying to do is to do some restructuring because you observe over the years there's a disconnect, between the people in the city and in the rural community. And we know that more than 70% of Nigerians, reside in the rural community. Most of the campaigns that we have, they are done conducted in big cities, like Abuja, Lagos, and Port Harcourt, creating awareness. You don't preach to the converted. People in big city, have enough information. The major issue is to make informed choices. That is what they are left with. But it's surprising to know that a lot of misconceptions are made, are taking place in rural community. Rural community, people don't even believe that there's something that's called cancer. Somebody have cancer of the breast, they'll say, somebody throw pepper at him or her. It's caused by witch and wizard, all manner of a misconception. And we also notice, that most of the advanced cases actually are from rural community. You see patients presenting with, from getting terminal, stage of this from rural community. So what we are trying to do, my administration, is for us to, take this awareness to the rural community. We're going to strengthen the urban centers and get that done. I came on board meeting a society that is over concentrated in Abuja. What I've done now is to create state chapters, and we are appointed state officers. That will address a lot of issues. For example, I'm in Abuja. I come from Abuja. I'm what's happening in Gombe, or in Delta State. But if we have a chapter in Delta State, for example, the state officers there, can step down our national policy, to that particular state. So just last week, we elected state officers, and they were officially inaugurated on 28th of January. And as we speak today now, in all the states in the country, including Federal Capital Territory, our state officers are, also doing what I'm doing in Abuja. So the idea is for us to carry these messages to the rural community, and not only that, we're also trying to translate, educational material. Because I said, the Nigerian Society is the oldest cancer society in Africa. We are the largest, cancer society in Africa. And so over the years, we've been, involved in a lot of educational, campaign when it comes to cancer, in our country, even beyond. Matter of fact, our founding fathers, actually, formed bigger body of cancer society in Africa that we call Realty. So we have such material, but most of those material, are basically in English languages. So what we're trying to do is to translate this material to our major tribes, and also, language, common language of our land. So we are in partnership with the Ministry of Health. That I discussed during my courtesy visit to the Permanent Secretary, Ministry of Health and Social Welfare. And both agreed to translate, this material into our common languages. And I've also mandated all my chairmen all over the country, that the try as possible to carry out the health campaign in the predominant languages in their state. We can't, be, for example, in a state where they speak basically maybe Hausa or Fulani, and we are carrying out campaign in English. There are quite number of population that may not compare what we are doing. So we are trying to do that also, so that we can get that involved. So I mentioned earlier on, my administration will look at neglected cancers, particularly cancers, that are increasing incidence in the country, that are also causing threats, to the health of Nigerians. So that we are going to do, to address, the increasing, surge that we have, particularly, colorectal cancer that is now, assuming very strategic, position, both in male and female, in our country.
Thank you, Prof. Very quick question. Titilayo, quick question. How do you afford your cancer treatment? And do you get access to to the insurance coverage. Prof is here. He's the one person that can help us understand this part. So can you talk to us? How do you get it? Layo, are you with me?
Ma, I'm here, ma.
Yeah, so how do you afford your cancer treatment? Now that we got Prof, he can help us if there's any issues that we need to get, because we're going to round up very soon.
Oh, okay. It has not been easy. It has not been easy in affording cancer treatment in Nigeria. Can be so challenging and overwhelming. I'm not doing anything for now. I'm not married. I'm not doing anything. I'm just hoping on friends, loved ones for support. The cancer treatments in Nigeria, the cost is so high. It's so high in Nigeria.
So how do you afford it? So how are you affording it? How are you paying your bill?
I family friends, they came through, and CHF CHF supported. They came through for me.
So
So that's
CHF as of now is covering your experience. It's covering your payment, your drugs.
Malcolm again.
Is CHF covering is CHF paying your cancer treatment? Are they paying for your medicine now? You are saying it's 1 point something million. Is CHF paying for it?
Yes, but not all. They are paying for some, not all.
So what is all? What is some?
The other ones, they are paying for eyebrows and Zoladex. Then the other ones, the letrozole and some hormonal drugs I'm taking, the calcium and all that is not in CHF.
So, Prof, in light of what our patient has just explained, what support systems are there for patients directly in the others? And why I'm bringing that is that I'm going to look at myself now, and a lot of people think, oh, yeah, she's doing very well. But honestly, it's because I think I have maybe not the financial, but the mental health, the physio, the occupational health, all those other things that really do cost money that don't seem to be captured. Every time I talk to a cancer patient, they always talk about everything else, and everything else is actually our issue. Let's talk about the medicine. The medicine is medicine, but everything else costs a lot of money that is not captured. And if those don't balance, the medicine doesn't take you a long way. Prof, that's you.
Yeah, thank you very much. And this Lyle's testimony is real.
It's a good
That
one.
is what most cancer patients and survivors face in our country. As I've said, cancer patients and cancer survivors are members of our association, society. And since I came on board, we can't be discussing their issue and they will not be actively involved. One of my strategic agenda is to pursue the welfare of all cancer patients and survivors. And what I've done is to ensure that we have at least one cancer patient survivor in all our committees, And you are rightly aware that I'm working very closely with the coalition of cancer champions to actually increase the number of slots on our board of trustees so we can have 2 cancer patients there. It's very important we carry them along in our decision making, because they are the one passing through the disease, and that is the emphasis, what USCC is promoting to World Cancer Day.
Thank you.
The patient-centered focus. We must listen to their story because they have a role to play. So what we are going to address, as I've said, basically in Nigeria, the mode of health finance is out-of-pocket financing, and most patients have to sort themselves out. But federal government have, done, tried some extent, providing some support system through the establishment of the cancer health fund. The fund is not adequate. I said the budgeting for this year is very ridiculous, low, not accessible to us as society. And I said the feedback from government agencies that something be done to top up that amount.
We look forward to.
However, I'm also in touch with the Ministry of Health and also particularly NECRAT, to ensure, that we create more access platform. Let's increase number of sites. We speak now, there's only 6 centers where that fund, can be accessed. So there's plan talks ongoing, to increase number of sites so more Nigerians can access the fund. That's what we are doing. But as a society also, we must also help our members. What we have agreed with NEC as approved, our National Executive Council has approved, is that we should also have an independent fund that we call Cancer Intervention Fund. And that fund, we are trying to put together 10 billion naira, and quite a number of substantial amount of that money will be used to support cancer patients. I mentioned to you, the federal government cancer health fund, only covers 3 adult cancer, prostate, cervical and breast. So happen to people that have colorectal cancer and people that have other kind of cancer. So the Nigerian Cancer Society, we are launching our fund this Friday, 7th, and we want to use opportunity to appeal to well-meaning Nigerians, philanthropists, well-organized private sectors, to donate generously towards that fund. What I've done is to appoint an independent board, to oversee, that fund, and then we've appointed Dr. Gafar Olowede, he's a very known, health financing expert to share that particular fund. And the prominent Nigerian will be there, we have lawyers, community representatives will be there, and I'm sure on the fund very transparent. Because as a society cannot sit down and continue to see our cancer patients suffer. Every day I receive phone calls, text messages of one patient or the other needing help, and they must rise up to do that. So that's what we are doing as a society in support the cancer patient. It's real. Many of our cancer patients have died because they cannot afford their medication. In fact, the truth is that some of them cannot even afford transportation, cost of transportation to the hospital. The follow-up, attention to follow-up rate in most oncology center, not encouraging. So Titi is even fortunate that she has some support system from her families. Many of the cancer patients, they are left alone. In fact, some of them that were gainfully employed because of, they have to attend treatment, long hours, long period of hospitalization. Many of them were relieved of their appointment. They are jobless. So that is the reality that we are facing in the country. And I think that we cannot continue to look at them. We must do everything possible, to support them. So that's why we're launching that fund, and to support cancer patients, and that, we appreciated. Just yesterday, the Federal Medical Center in Abuja.
Yeah. Thank you. You've actually addressed quite a lot of the things, and I think this conversation will have to keep going on. But this is World Cancer Day. We'll be coming back, and hopefully we will talk to your youths next week and see what they also have to say to bring your work into light, because it's quite nice to listen that you have set up all these committees and you've put cancer patients on board and you've put cancer patients at the heart of it, which is very, we appreciate it. And I think I think I will speak for Titi and I. We do appreciate the government. We're not saying we don't. However, we think there's a lot more to be done. Titi, am I representing that correctly? Did I represent that correctly? Did you hear me?
Yes, ma, you did.
All right. So I want to say thank you for the time. I know you have a very busy day. You're about to go and do all your campaigns, all the work for today, and it's a very busy day. But thank you for taking your time out to be with us. Thank you for everything, and to all our viewers. And Titi, I want to thank you for coming on and speaking today.
Thank you so much for your.
Sorry, what did you say, sir?
Thank you very much for inviting me. Thank you very much for the invitation. That's why I'm very scarce. As mentioned to you earlier on, anything that has to do with cancer patient, cancer survivor, is topmost top in my priority.
Yes.
I'll continue to protect their interests and also their welfare. Thank you.
Thank you very much. So everyone, will see you soon. Have a lovely day. Together we fight, together we win. You should follow us on our social media handles. Common Cancer Power. All our spaces, you'll find us there, Instagram, Facebook, YouTube, everything. And this video will be out there. So please share it and let us start to create a new 2025. It's a different year, and we've got a new government in the Nigerian cancer space. Let's start to see how we can work together. Share, subscribe, and click. Thank you very much. See you all soon, and have a lovely, lovely World Cancer Day celebration.
our message is very clear. Together we'll fight, together we win.